This is Susan, an 87-year-old woman from Southern Ontario. She is single, enjoys Skyping with her only son and grandchildren in Alberta, and is part of the knitting club at her local senior center. A few years ago, Susan was diagnosed with moderate stage Alzheimer's disease by her family doctor. Because of this, she often forgets her address and phone number, needs help from her son with paying bills, gets her pharmacist to help organize her pills, and occasionally needs help from her local policeman to find her way home from the park. She also has had high blood pressure for many years, which is controlled by medications, and is on a wait list for cataract surgery. Unfortunately, her blood pressure medication makes her need to pee often, and 3 months ago she couldn't find the bathroom on time. She slipped and fell, resulting in a broken arm that left her in the acute care hospital.
Acute care is described by the World Health Organization as the time-sensitive, individually oriented, diagnostic, and curative actions whose primary purpose is to improve health. This includes a range of healthcare functions as illustrated in this image.
Immediately after the incident, Susan's son flew down from Alberta to help her with her care, and after a few weeks in the hospital, her condition became stable. However, she is not stable enough to live independently again. Her son wants her to go to a nursing home since she has little support nearby and can no longer handle many activities of daily living, like cooking, cleaning, and dressing herself. Unfortunately, wait times have gotten worse for admittance for long-term care from the hospital in Waterloo, Wellington since last year. Susan can expect to wait a little over 2 months, so for now, she is stuck in the acute care hospital as an alternate level of care patient.
In acute care hospitals, we have what's called alternate level of care or ALC patients. These patients have not been discharged to a post-acute provider or to the community, even though they no longer need the intensity or specialized medical care provided by acute care hospitals. Someone is distinguished as an ALC patient when their care goals have been met, their progress has reached a plateau, and the services they need can be provided elsewhere in the community. ALC patients have a median age of 80 and are more likely to be female, have at least one comorbidity, and are likely admitted through the ER.
So what is the problem with alternate level of care beds? For one, there are increased hospital and long-term care wait times. They're expensive. And lastly, there are negative impacts on families and the patient. Why is this important to know? Canada's population has been steadily aging since 1960, and it is estimated that seniors will comprise 23 to 25% of the population by 2036. Since the risk of ill health and disability increases with age, higher demands will be put on the healthcare system. This further perpetuates problems of acute care hospital bed overcrowding, bed shortages, and declining health for those patients who are waiting for proper placements.
After her third week in an acute care bed and a week after her son left her to go back to work in Alberta, Susan developed a pressure ulcer. This was the consequence of spending her days sitting and having little opportunity for mobility. She was also tired most of the time. She spent her nights awake in bed because of all the noise in the hallways and only slept a few hours a night. Susan was sick of being in the acute care hospital.
But where should we put Susan instead? Her options include home, with or without home care, rehabilitation centers, continuing care clinics, long-term care, group homes, convalescent care, palliative care, retirement homes, shelters, or supportive housing. However, not all options work equally for all seniors. As shown in this graph, the older you get, the more likely you are to live in a collective nursing home or seniors residence. Only 5% of seniors 65 plus in collective homes, but for those seniors who are 95 plus, the numbers raises to 44%. For ALC patients in particular, 54% are discharged to long-term care.
Since long-term care is such a popular destination for ALC patients, let's learn a little more about it. As seen on the screen, long-term care homes are covered privately and publicly for reasons ranging from frail seniors needing permanent placement to respite beds to give caregivers a break from caring for their loved ones 24/7. With this being said, the average time to placement in long-term care in Ontario as of June 2017 is 137 days, and the waitlist for long-stay beds is over 32,000 people long.
The following headlines are further evidence that increased public funding is necessary for long-term care facilities, not only to prevent long wait times, but to ensure acceptable living conditions for our seniors.
Luckily, because Canadian media outlets have brought the problems of long-term care and ALC patients to attention, it has become more likely that the government will take action. We suggest that the most effective approach for reducing rates of alternate level of care and acute care hospitals is to increase public funding for long-term care nursing home beds. If allocated correctly, more funding will improve the quality and number of long-term care beds and decrease the number of ALC beds, leaving more space in hospitals for acute care patients.
Susan was lucky, however. She received a phone call stating that a nursing home in Alberta with private beds had space available for her. Since she could afford the cost, she was able to move in, make new friends, and go for daily walks like she used to. Susan is happy and thankful for her new living situation, but she wishes that other Canadian ALC patients could be just as fortunate as her.